Welcome back to HealthCap Weekly Wrap. Today we're going to talk about what's shaping the day-to-day reality of senior care right now. From growing regulatory pressure and survey readiness to practical infection prevention strategies like enhanced barrier precautions and skin-focused MDRO prevention.
We'll also look at how staff training is evolving with more hands-on scenario-based approaches, why communication tools from the CDC are becoming increasingly important in the fight against antimicrobial resistance, and finally, where the future is headed with new research focused on dementia care in nursing homes.
A lot to cover, but it all ties back to one big theme. How do we make care more consistent, more effective, and actually workable in the real world?
So let's start with something that's probably on everyone's mind right now, especially if you're in senior care leadership or clinical roles, and that's regulatory readiness. There's a 2026 Regulatory Readiness Guide for directors of nursing, and this comes from Activated Insights, and honestly, it sets the tone for everything else we're going to talk about today.
Yeah, and what stood out right away is how much the survey environment is shifting. It's not just about checking boxes anymore. It's getting a lot more data-driven, a lot more evidence-based. Surveyors are looking for consistency, patterns, and proof that what you say you're doing is actually happening.
Right, and one of the biggest risks the guide calls out is documentation gaps. Not just missing documentation, but inconsistencies. So you might be doing the right thing clinically, but if it's not reflected clearly and consistently across records, that's where organizations are getting into trouble.
That's such an important point, because it really ties into operational discipline. It's not just clinical care, it's how well your systems support that care. And of course, no surprise, infection prevention is still one of the most heavily scrutinized areas.
Yeah, and the guide also emphasizes ongoing staff training and competency validation. Not a one and done. It has to be continuous, measurable, and tied back to real practice.
So the big takeaway here is pretty clear. You can't be reactive anymore. You really need a system-driven approach to readiness. And for senior care providers, that means aligning clinical, operational, and documentation practices before the survey team walks in, not after. And just a reminder, HealthCap offers a lot of free resources and webinars on documentation, so you should definitely check that out.
Exactly. So that's kind of our backdrop. And from there, it makes sense to zoom in on one of the biggest focus areas under that regulatory lens, which is infection prevention.
Yeah, and this is where the MDRO and MRSA prevention toolkit from AHRQ comes in. And while it's not brand new, it's still highly relevant. And one thing it really highlights is skin integrity.
Oh, say more about that.
Yeah, so instead of jumping straight to higher level interventions, the AHRQ toolkit emphasizes skin health as a foundational prevention strategy. Protecting skin, managing wounds, those are key pieces in preventing multi-drug resistant organism transmission in senior care settings.
That's interesting because it's kind of going upstream, right? It's not just reacting to infections, it's preventing the conditions that allow them to spread.
Exactly. And the AHRQ resource is very practical. It includes structured tools, staff training materials, and what they call teachable moments. So it's built to support real implementation across the facility.
And I like that it's framed as a coordinated facility-wide effort. Because one of the biggest challenges is consistency across shifts, across staff, across departments.
Right, and this really supports that. So for listeners, the takeaway is, if you're thinking about infection prevention, don't just focus on policies. Look at the fundamentals like skincare and make sure your team has the tools and training to support it. And again, HealthCap has a ton of materials on skincare, including an entire webinar series. Check it out on our resource and education center.
Yeah, and that naturally leads into what this actually looks like in practice. Because it's one thing to have a strategy, it's another to execute it day to day. And that's where the AJIC podcast on Enhanced Barrier Precautions comes in.
Yeah, this is from the American Journal of Infection Control's Science into Practice podcast, episode 45. And it really focuses on real-world use of enhanced barrier precautions, or EBP, in nursing homes.
Right, and one of the key points is that EBP helps reduce transmission without unnecessary isolation. So you're not defaulting to the most restrictive measures in every situation.
Which really matters because those decisions impact residents directly, especially in terms of quality of life.
Exactly. And the AJIC discussion emphasizes that balance. Infection control on one side, resident-centered care on the other, and finding a way to do both well.
And it's not always easy. The episode also gets into the challenges, making sure staff understand when to use EBP, how to apply it correctly, and how to stay consistent.
Yeah, and that's where staff buy-in becomes critical. If it doesn't make sense to them, or if it doesn't fit into their workflow, it's not going to happen reliably.
So for senior care providers, the takeaway here is that infection prevention has to be practical. It has to work within the realities of your team, your staffing, and your residents.
Right, it has to work in the real world, not just sound good in theory.
Okay, so we've talked about the what and the how. Let's talk about the people side, because none of this works without effective training. And this is where another AHRQ resource comes in, the escape room style infection prevention training tool.
Yeah, this comes directly from AHRQ as well, and it's designed as a teachable moment within a broader infection prevention program for long-term care.
And when you say escape room, you don't mean just for fun, right?
No, not at all. The AHRQ tool uses realistic clinical scenarios where staff have to make decisions. Things like what PPE to use or what the next step should be. So it's focused on decision-making, not just engagement.
That's great because it moves beyond passive learning. You're not just sitting through a presentation, you're actively participating.
Exactly. And that's what helps with retention. When staff are working through problems, they're much more likely to remember and apply what they've learned.
And it probably also helps surface gaps, right? Like if someone makes the wrong choice in a scenario, that's an opportunity to correct it.
Yeah, in a low-risk environment. Which is exactly where you want those corrections to happen.
So for organizations, this is a reminder that training should be engaging and practical. It's not just about delivering information. It's about building real skills and confidence.
Right. Learning sticks when people actually practice, not just listen.
Okay, so we've been talking a lot about what happens inside the building. Let's zoom out a little and talk about communication more broadly. And this is where the CDC Antimicrobial Resistance Communication Toolkit comes in.
Yeah, this is from the Centers for Disease Control and Prevention, the CDC. And it's a communications toolkit designed to help organizations educate healthcare professionals, the public, and other stakeholders about antimicrobial resistance.
And AMR is a major issue. It's a growing public health threat, and it has direct implications for senior care because of the populations being served.
And what's helpful in this CDC toolkit is that it's very practical. It includes key messages, graphics, videos, and other ready-to-use material.
So you're not starting from scratch when it comes to communication.
Exactly. And it's designed for multiple audiences and channels. So you can use it for staff education, family communication, newsletters, events, even social media.
That's really valuable, especially for organizations without large communications teams.
Yeah, and the emphasis is on clear, consistent messaging that supports awareness and preventive actions.
So the takeaway here is that communication is a critical part of infection prevention. It's not just about protocols, it's how you bring everyone along.
Right. Communication plays a major role in slowing the spread of drug-resistant infections.
Okay, so let's shift to what's coming next. Because everything we've talked about so far is very much about current expectations. But there's also movement on the research side.
Yeah, and this comes from the IMPACT Collaboratory, specifically their 2026 announcement about embedded pragmatic clinical trial planning grants published through Rethinking Clinical Trials.
And this is focused on dementia care in nursing home settings, which is really significant.
Exactly, and what stands out is the emphasis on developing real-world, implementation-ready trial protocols. So this is research that's meant to be used within care delivery.
Right? Not just published and set aside.
Yes. And there's a strong focus on generating evidence within care settings through partnerships with nursing homes and other stakeholders.
That's huge because it helps close that gap between research and practice.
Exactly. And the focus areas are very specific. Non-pharmacological, person-centered approaches to dementia care, including addressing behavioral and psychological symptoms.
which ties into ongoing efforts to reduce reliance on medications like antipsychotics.
Right. So for listeners, the takeaway is that the future of care is going to be shaped by research that is practical, scalable, and grounded in real-world environments.
Yeah, it's about making sure the evidence actually works where care is delivered.
So when you step back and look at everything we've covered today, there's a clear through line: increasing regulatory pressure, continued focus on infection prevention, the need for practical implementation, the importance of staff training, the role of communication, and this push toward more embedded research.
Yeah, it all connects. And for senior care providers, it really highlights the importance of taking a systems approach. Ask yourself, where are the gaps? Is it documentation, training, consistency, communication? And what's one step you can take this week to move toward a more proactive, system-driven approach?
Right? It's not one initiative. It's how all of these pieces come together.
And the organizations that are going to do well are the ones that are proactive, that are building systems, investing in their teams, and staying ahead of both regulatory expectations and evolving best practices.
Yeah, not waiting for problems to show up, but actively designing for better outcomes.
And if you want to go deeper on any of these topics, all of the stories we talked about today, with links in more detail, are available on Angie's blog at healthcapusa.com/Angie's-blog.
Definitely worth a read.
Absolutely. And we'll see you next time.